Hi, I'm Gregory Pope, founder of SpinalSurgeryMexico.com. Ivan is coming for lumbar surgery. He's arriving on March 31st on Easter Day, very late. My transport service is going to pick him up, take him to the Hampton Inn, which is next door to Star Medica, and I will be picking him up Monday morning at 9 a.m. and taking him to the hospital that you will see to meet Dr. Simone and Dr. Vera. Dr. Vera is a cardiologist. He's going to check him out. His EKG came back a little funny that said he may need a pacemaker. So he's going to do an echocardiogram, a 3D CT scan, and check and make sure that he might need to have a temporary pacemaker or a permanent pacemaker. We're not sure, and we won't know until those studies are done on Monday, and surgery is scheduled for Tuesday morning. So thank you very much for watching the video. I think you'll find it very interesting. Ivan, I want you to meet Dr. Vera. He's an interventionist cardiologist with the American Association of Cardiology.
Okay.
So he's very, very smart in what he does. He's going to put you through an EKG, echocardiogram, CT CAT, 3D CAT scan to check and make sure that you're healthy enough to have surgery. There's always that chance that you won't be able to have surgery, which I told you is a possibility.
Yeah.
It could be a temporary
pacemaker.
Yeah.
Or if he already knows you have a problem with electrical in your heart.
Okay.
So it's a matter of whether it'll be a temporary or a permanent one.
Okay.
Okay?
So there is a chance of that?
I mean, yes, but I would like to run the test before I get to a conclusion. But last time I told Greg that it would be advisable to have a CT scan of one of the patients. And one patient from Canada told me that it would take 6 months to schedule the study.
Oh, it can, yeah.
So it's too long. So we're going to do it right now. Okay?
Hello again. Here we are making a house call at Casa Marino for our last patient who came from Manitoba, Canada, to have his surgery done. I think it's been 10 days since he had his surgery. This guy, Ivan, an old 73-year-old guy, has been suffering for more than 5 years of lower back pain and pain in the legs and also weakness. That weakness forced him to use a cane on a daily basis, and when he arrived to the airport and here to Querétaro, Mexico, he has his cane with him, and I'm so glad to see him today walking without a cane and feeling very, very good. What he had, it's a spinal compression, a spinal canal compression at 3 levels between L2, L3, and L4, 5. And the plan with him was to do a foraminotomy bilaterally in between L2, 3, 4, and 4, 5, and as we did in surgery. And also because of that foraminotomy, which was very wide foraminotomy in order to decompress the nerves, we had to stabilize the spine, and we use our famous and most loved system, a dynamic system which is called Cosmic Mia. This kind of screws, I'm going to show you because I have one here in my neck as a tribute to my patient. This kind of screw has a hinge between the head and the thread of the screw, so it won't fuse the spine but stabilize, avoid abnormal translation movements between vertebrae, but without losing the flexion and extension normal movement of the spine. So we get the stabilization without fusing the spine. That allowed us to avoid the adjacent segment disease, which is very common in fusions. We have been using this system since like 20 years ago, and in the last 20 years, we haven't do any other surgery to our patients with this kind of system. And now I'm glad, again, to tell you that this patient is 100% satisfied with the surgery and now ready to go back to Canada. Any questions or any doubts, or if you want some help with your spine, please don't hesitate to call or search in the web for spinalsurgerymexico.com. Hello!
Hello!
Mr. Ivan Nolt, may I come in?
You may come in. You are certainly welcome.
How are you? I've seen a video from you yesterday.
You think it was the right one?
I don't know, what do you think?
Well, shall I prove it to you?
So, you look great. How you feel?
No cane. He came with a cane.
Yeah, I remember that in the
and
hospital.
No cane.
Where did you leave the cane? You lost it? You lost the cane?
It's over there yet.
Okay.
I use it outside.
Are you gonna hang it in the wall like a memory thing or stuff or something?
Well, I hope I can for a while anyways, because I'm getting older and some...
Yeah, you're gonna need it. You're gonna need it, of course.
But no, it's been great. Had some poor nights.
Are you happy?
Oh yeah. You know what? It's hard not to be happy here.
Okay. That's because you're in Mexico.
That's right. And that's because we got to know nice people.
Oh, that's great.
Oh yeah, no, it's just been an incredible experience.
Well, I think it's tough
It
at the
is.
beginning.
It is.
All the way of phone calls and sending images and all that stuff, and then making the decision to come here and have surgery.
Yeah, yeah,
And
it is.
Wow.
It is quite an experience because, well, like I said, I think when we even came, I said, we were in the Winnipeg airport, and I think I said to Susan, I said, you know what, let's go home. But no, I didn't want to go home. I wanted to go through with this thing because, and I'm starting to realize with the therapy I've been going through now, with my muscles and everything, see, it's been, well, 5 years.
Okay. Wow.
And to get that all back, I didn't realize. And then now, as I think of it, if I would have waited another month, not sure what I would have gone through, even here. And at home, I don't even want to think about it.
So far, how is your balance about getting here to Mexico to get your spine surgery? Are you satisfied so far
Okay.
about the results?
Repeat the beginning.
About the result of the surgery.
Okay,
so
result
far.
was,
Are you satisfied?
Oh, yes.
Are you happy?
oh yes,
How much? From 0 to 100.
100%.
100%.
I don't know what to say. It's just great. It's just
That's
great.
fantastic. That's fantastic. Okay. I just want to watch your scar, please,
Okay.
just to be sure that everything is okay. You're starting to make a little rash there because of the tape. If you feel comfortable without a tape, you can't be without a tape. Okay?
Okay.
So you won't have this itchy thing here.
Oh yeah. Oh, maybe that's what the itch is, huh?
Looks great, nice and clean. It's perfect. Okay,
Yeah.
take care of you. Give me a hug.
Well, you know what? We are leaving a lot of friends behind.
Yeah. And as I told you before starting the anesthesia for surgery, don't cry, smile.
Yeah, I get emotional, so.
Yeah, those are happiness tears.
Oh yeah.
Huh?
Oh, that's what they are. Yeah.
Take good care of
You
guys.
take good care too.
Great meeting you, huh?
My name is Ivan Nolt. I'm from Manitoba, Canada. And my journey started, well, actually it started before, but 5 years ago. And if you think you have a problem, then look into it. And don't just, if you have trouble with the doctors, demand to know what it is. That I wish I would have done. So what we did then is we knew of Germany and we've heard about Mexico. So we went on the internet and we started looking around. And this is where we came up with Spinal Surgery Mexico. Looked at their website and I was very impressed right away. So then we messaged Greg Pope and then I think it was the next day he responded, and that's where it all started. So then we tried to get the things together that we needed, that Dr. Simone needed. What it says in the website there, it is a great place. They come and pick you up. And we have made some special friends here. We wish we could just come back and visit. Maybe time will let us come back. We don't know. If you have any doubts, and if you think you have any trouble, look at it before it's too late. For me, it wasn't really too late, but the longer it goes, from what I have experienced, the longer your road to recovery is going to be. I know it is a very big decision, and for us it was. It wasn't lightly made. But I'm happy today that I can look forward to walking again properly and enjoying life.